Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. And today we are going to do listening. And listening is something that is very, very important these days. As you guys all know, that these days, especially the last result that came, listening was a trouble for most of the people. It can be because of various reasons that the last time listening was trouble. uh, Maybe more of the students took the exam. Maybe the exam was difficult. But to be very honest, as per my experience, it does not make a difference if the listening was difficult because OET exam is majorly the exam that is based on percentile method. Means number of students who score better means there would be a certain cutoff. If exam would be difficult, then the cutoff would be around, I would say, if the exam is difficult, cutoff should be around like 29, 30. If the exam is easy, then the cutoff will be around 32, 33. So it all depends upon the exam, but at last it is about how good we are. So the better we are, the more chances we have to pass. It does not matter whether the listening was difficult or easy. If the listening was easy, cutoff will go higher, means 33 can be the passing marks. The same applies to reading as well. That is why in OET there are no certain marks. Like in IELTS exam, 30 out of 40 means 7. But in OET, you don't have these scores. So that is where you need to be an expert, and each and every question makes a difference. So today we are going to discuss the various strategy that are applicable in the listening. And I have also not done this listening. I don't know whether it's going to be difficult or easy. And normally I don't practice listening as well. But I will try and do in front of you. So what's gonna happen in the part C extract? This is most probably the original listening from OET, but let's see how it is. In this part of the test, you will hear two different extracts. In the part C, two extracts are there, 31 to 36, 37 to 42. So you get almost like 12 questions to solve your listening. Then they say in each extract, you will hear health professionals talking about various aspects. 31 to 42, choose the answer A, B, or C, which fits. Complete your answer as you listen. Then you go forward. Then in the start, you will get some time, maybe around like 90 seconds or 60 seconds. I don't remember. Again, I'm not, I do not practice listening too much, but you guys do practice every day. You know how much time it is there. So in that time, what you need to do is to read the questions only. So what Sandra Morton see main aim in her work. The students who are my old students, they know main word is the one that I would like to notice. Even in the reading, that will stay the same. Main aim means she can talk about various aspects of her work, but then she will talk about my primary thing is, my main thing is. So you have to focus on that word where doctor will say my main duty is, my main responsibilities, my primary responsibilities means I have to focus on those words. Second, when Harry was offered a routine health check at his local surgery, he initially. So we want to know the initial reaction of Harry. Second question. Initially, so in this case, this word would be my main word. Means she can talk about various reactions. But when routine health was offered, what was the first reaction? Second, I have done this listening, I guess. As I am reading, I can sense it that I have done it before. During Harry's investigation for the prostate cancer at a hospital clinic, the main word is again, we do not notice these small words, and that is what causes problem in reading and listening part B and C. The main word in this I would like to tell you guys is during. The people who are weak at English, they also need to notice this was plus third form. When Harry was offered a routine health check by the doctor, it's a passive voice, was plus third form. So if you notice these small things, you understand the question well. Now, if I say, when doctor offered Harry a routine health check at his local surgery, what was the reaction of Harry? At first, main aim of Dr. Morton. During Harry's investigation, this apostrophe S is very important and the main word is during. That means when his investigation was ongoing for the prostate cancer, what was he feeling? He felt part, he found it hard, was given false hope. Let's see. So as I am teaching you, that's why I'm taking time. Otherwise, these three lines hardly takes like 15 seconds, maximum 20 seconds. Initial reaction of Harry means if I am alone in the exam, I will try to remember and will underline it. Initial reaction of Harry, main aim of Sandra, what was the feeling when investigation was being carried out. Question number fourth I have, what was Harry's response to being diagnosed with prostate cancer? So basically now you can understand the topic. Why questions are important? Because they tell you a story. Means Harry was a person. Sandra is a doctor who must be related to prostate cancer. She would tell a student a story about Harry. Harry, obviously her patient, and she would have invited Mr. Harry for investigation. Initially, Mr. Harry would have said, "Nah, I don't want to come." Obviously, initial reaction would be, "Why do I need it? I am all good." Generally, then during the investigation, what would have been the feeling of Harry? Harry would have felt like, I'm little anxious, I'm little worried. What would be the outcome? So now this is a story. Now then it makes your listening easy. Then what was Harry's response to being diagnosed? So finally he was diagnosed with prostate cancer. So what will happen? He will obviously mind it a lot because the person who was not expecting at all, he would be shocked. Natural reaction. What typical patient response to illness does Sandra mention? So what is the typical response of normal patients? It's not about Harry. What is the typical response of the patient to illness? Normally they might feel upset, or sometimes people ignore their things. They ignore their illness. There are only two things. If somebody is diagnosed with cancer, either that person will ignore or he will become over anxious. Sandra believes that community follow-up clinics are important because they. So these are the six questions. Now I can understand that Dr. Sandra is going to talk about prostate cancer today. There would be a patient named as Harry. We need to know about her initial reaction, his initial reaction, what was the feeling, then what was the feeling after he was diagnosed, typical reaction of the patients, and community follow-up clinics, why are they important. So now I can understand the topic, and it does make a lot of difference because your mind starts working straight away. So now let's do the listening and let's listen to it.
I'd like to tell you.
Okay. So as soon as they will start playing listening, now I will start reading these things, and let's see how much time does it take to read these three things by the time she is talking.
My name's Sandra Morton, and I'm a specialist cancer nurse, helping cancer patients deal with their
So now I have read three important words by the time she had just started speaking. First, Sandra Morton's main aim is to talk about different treatments. Different treatment. So don't only notice the word treatment, also notice the word different. So different treatments, availability of the test, investigations, or the symptoms. What is the main thing that Sandra does? Does she tell the patient about symptoms? Does she tell the patients about test? Or does she tell the patients about the treatment options? Let's see. So this is what happens. I'm just telling you what should happen in your mind by the time they are speaking. Now I have read these three things. By the time she speaks, let's see.
diagnosis and treatment. I'd like to tell you about the type of work I do, and particularly about one of my patients, recently diagnosed with prostate cancer. Let's call him Harry, to illustrate the sort of things I get involved with. Now, before we get on to Harry, I'll give you a bit of background. Clearly, my job covers many aspects of patient care, but what's the priority? Firstly, prostate cancer is in fact the most common cancer in men in the UK, with over 40,000 new cases diagnosed every year. That's a staggering number. One problem is that this type of cancer actually develops very slowly, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible, that we tell them how to spot the signs of prostate.
Now she is talking about that thing. That is where they confuse you. She talked about the thing primarily and then she talked about something else. Then she said that people like me are supposed to tell about the signs. That means people like me would like to tell the people about the symptoms, that we like to raise awareness about the symptoms. Let's listen to it again. Just the last line.
In men in the UK with over 40 only, so there may be absolutely no sign that you have it for years. So, if we're going to reduce the number of cases, it's vital that people like me get the word out to as many men as possible.
People like me get the word out. Word out means words, the words we speak. So people like me have the responsibility to get the word out to as many.
That we tell them how to spot the signs of prostate.
We tell them how to spot the signs of prostate cancer. So our job is to tell the symptoms and signs. Let's listen to it again.
Out to as many men as possible, that we tell them how to spot the signs of prostate cancer, like an increased need to urinate or straining while urinating. Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which point the available treatments are far less effective. So, let me tell you a bit more about my patient Harry.
Now she has talked about symptoms, signs. Symptoms she has not spoken, but she has talked about urinating and stress and something like that. But the major thing, how to use elimination method, you might have reached to see it. This question was easy, but how to use the elimination method, that when she was talking about the treatments, she did not talk about different word. And then she did not talk about that she wants to publicize again means awareness. She doesn't want to make the public aware about the test. Let's listen to this last thing again, how to use the elimination.
Unfortunately, the cancer can be at an advanced stage by the time patients come in for tests, at which
So the test word, she is saying that when people come to test, they are at an advanced stage. So she is not raising awareness for the tests.
the available treatments are far less effective.
And available treatments are far less effective. So she is not talking about that different treatments to offer. She's not offering any kind of treatment. She's saying people come late, and at that point of time treatments are less. So she does not have lot of different treatments to offer, because she is saying that treatments are less when people come to an advanced stage. So that is how you rule out or eliminate these two options, and you reach to this question as C. Now let's take the second question.
So, let me tell you a bit more about my patient Harry. Like many middle aged men, Harry was offered a routine health check at his local doctor's surgery.
That is where you should become very, very active, because straight away she is talking about the keywords of your question at his doctor's local surgery. So now become very active.
As far as he was concerned, he had no particular health problems or obvious symptoms at the time. And
So he did not have any symptoms. There was no problem.
so he almost ignored the invitation. But he
So that means he ignored the invitation. Means how, what was the initial reaction? That he did not have any problem, so he ignored. That means resisted the idea due to his wife's experience. They have not talked about wife until now. Felt that he was too fit and well. That he was too means very. He was very fit and well to be in need of it. Now this option confuses you like hell. So the people who are learning new English will have lot of problem in understanding this option, because two words is something that sometimes we do not understand. Two words means I am too good. I am too good to pass means I am not good. I am too healthy to go for test. That means I am very healthy. I don't need test. In the same way, Harry was feeling that he was too fit and well. That means he was very fit and well to be in need of it. That means he did not need it. Too word is a very, very choosy word. This person is too good for the work. So you might feel that he is very good for the work. No, this person is too good means he is more than good for the work. That means we don't need this person. This person is too good for the work means no, we don't want him. He's too smart. Smart is the word you understand. He is too smart. Too smart means he's over smart. So we don't want him. So that was the trick over here. But again, that is where elimination method will help you. So normally all my old students you can listen, and the people who are listening to this YouTube recording for the first time, but the people who are old to this YouTube channel, and especially my students, you all know the only word is always under elimination. Only word, always word, everyone, everything, these word go for elimination. But if they are used with, if they come with note, then that becomes the best choice of option. Normally now in this option there is no word like note, so that means only word should be eliminated anyhow, 99% elimination. And this is like due to his wife experience, he resisted the idea. Let's see what she speaks now. So we have read the options well, and in his initial reaction was he ignored because he thought that there was no symptom, he did not have any problem. So answer should be B, but let's do the elimination now.
Routine health check at his local doctor's surgery. As far as he was concerned, he had no particular health problems or obvious symptoms at the time, and so he almost ignored the invitation. But he'd promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go.
So that means his wife had ovarian cancer. That is why he went to clinic. Now this is eliminated. He resisted the idea? No. Rather, he accepted the idea. Resist means stop. He accepted the idea due to his wife's experience because she died of ovarian cancer. So wife experience was bad, and that is why he accepted the idea. He did not resist the idea. So it is absolutely opposite to what she is saying. Just a second again.
But he'd promised his family he'd look after himself. His wife had died of ovarian cancer some years before, so he felt obliged to go. It was during his appointment that, based on a few symptoms he mentioned, Harry's doctor decided that he'd need further investigation for prostate cancer and referred him to a specialist clinic at the hospital.
So now when you know this answer, only word anyhow is eliminated. So, and again, why these words are eliminated? Again, all of my old people know, old students know that he initially only agreed to attend. Only word is a very strict word. It becomes very, very small. Means options, it does not give you that chance of probability. He only agreed to attend because his doctor advised. No. He first, his initial reaction was that he did not agree. So the important word was initially. Then that would have made you reach at B. And now question number third.
His trip to the clinic stopped.
Now she has spoken all the keywords, investigation at hospital clinic, all the keywords she has spoken.
It referred him to a specialist clinic at the hospital.
Now guys, what was the main word? During. That means when he was undergoing investigation, what was he doing or feeling?
Harry's trip to the clinic started with a routine blood test, which initially showed a slightly low hemoglobin level. A further test then revealed that his PSA, the prostate-specific antigen, was high at 20. He then saw a urology consultant who conducted a digital rectal examination and biopsy. A procedure that I always try to explain to patients may be uncomfortable, but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal.
Now this is the key. Each question has a trick, and I am here to tell you about different tricks. So obviously it takes time, so stay patient and please listen to it very nicely. Now the trick was during Harry's investigation, he felt part of examination procedure was unpleasant. Harry never felt that the procedure was unpleasant. Doctor told that it is little uncomfortable. So Harry never said it was uncomfortable. My question is based on he. So that is where sometimes small mistakes happen. because we do not read the question well. During Harry's investigation, he found it hard to cope. Yes, because Harry told that the time interval between the test and the outcome was far more of an ordeal. Ordeal means a bad experience. So the only thing Harry, until now, what she has spoken, the only thing that Harry has felt is that he found it hard to cope up to wait for result. Outcome means result. Again, elimination is easy because in the right option there would be always synonyms, like she replaced the word outcome with results, so you will find it hard to find. But you can eliminate this thing because Harry never said that examination was unpleasant. Let me make you listen again.
In fact, though, Harry said the 3-week date-specific antigen was high at 20. He then saw a urology consultant who conducted a digital rectal examination and biopsy, a procedure that I always try to explain to patients.
I always try to explain. So Harry never said that it was he felt. He felt means it is something that is related to patient. Patient should have felt. But this is doctor who is saying.
Examination and biopsy, a procedure that I always try to explain to patients may be uncomfortable but is entirely necessary.
And the major word, again, all my students understand that you could have eliminated the word may, grammar. She is saying it may be unpleasant. If by chance you were in hurry in the exam and you could not understand that whether Harry said, because you will get one chance. Now though we have so many opportunities. But in exam, please pay attention to grammar that it may be uncomfortable. So we can never say he felt uncomfortable. He felt that it was. He may have felt. He might have felt. Please understand, even if you notice the good grammatical things in a sentence, then also you can eliminate. Again, the last time.
Explain to patients may be uncomfortable but is entirely necessary. In fact, though, Harry said the 3-week interval between having a biopsy taken and hearing the outcome was far more of an ordeal. Harry told me that when he went to see the consultant to get his results, he immediately sensed he was in trouble. He went to see the 3-week in.
So now by chance they are turning over the page, but the thing, so he went to the consultant and consultant told he was in trouble. He was given false hope? No, he was never given a false hope because his PSA antigen was positive, was high. False hope means that I give a positive hope which is not there. That means I gave him the false hope that there is nothing wrong with you. So no false hope was given. He was told immediately that your PSA was high, so you need to have a rectal examination which may be uncomfortable. And Harry found it hard to cope up to wait for the result because he said the interval was too long. So I will stop this recording now, and please subscribe our channel. Again, I know this video is, I take time, but I have to tell you what your mind should think in all these small seconds. Now we will do question number 37 to 42 because I have already done the rest of the questions too, because I remember I have done this listening. So I will try to take a fresh listening. You will get another recording, guys who are not here. So go for the recording on the same day. Now I'm going to open 37 to 42. So stopping the recording now, and then we'll record another one. Thank you so much. This is Dr. Bhupesh from Dr. BK MOIT Institutes. Thank you very much for your patient hearing. And now we will take 37 to 42 questions because you were saying those questions were difficult and also I might not have done it. Thank you very much. Thank you.